Hello, and welcome back to the Digital Twin Theory, a podcast about the future of healthcare produced by the Virtual Physiological Human Institute. I am Davide Montesarchio, your nerdy host and science communicator. You know, many times our followers ask what we can actually do within Silico medicine. And today, all of them will be served since we will speak about cardiovascular applications with our guest, Mariano Vazquez, CTO and CSO at ELEM Biotech, a spinoff of the Barcelona Supercomputing Center in Spain, where Mariano is also a researcher. So, good morning, Mariano,
Hello, Davide. Good morning. Thanks a lot for the invitation.
and thanks for joining us. So, Mariano, simulations are the core of in silico medicine. So, what we can simulate about the heart and the cardiovascular system.
I am a physicist by training. So I'm not a physician. My background in biology is very weak. So over the years, I was learning, but my background is closer to an engineer. So for me, the cardiovascular system is really very appealing to simulate because it is complex. It has plenty of physiology also, but at the same time, plenty of physics. So it's really a challenge. And this is a very good reason for putting in the center of biomedical simulations the cardiovascular system. So for us, the heart is a tightly coupled system in which we have equations for electrophysiology, coupled to equations for mechanics, and coupled to equations for fluid dynamics. And also to the heart, it is coupled the circulatory system. So we have a model for the circulatory system.
What level of detail it is possible to achieve with those simulations?
The heart, the ventricles, and the atria is divided in small chunks. They set the size of the problem. So in our case, the small chunks in which you pack many cells and you simulate the behavior of this bunch of cells could be of about, let's say, 0.1 millimeters. So this is the level of detail that we use in production for the simulations we use in production. Of course, you can go really down to the cell, but for the problems that we are solving, which can be cardiac safety, cardiac resynchronization therapies, valve implants, ventricular assist devices, for these kind of problems, this level of detail is reasonable.
And so, are these simulations already applied to real patients or at the current stage we are in research?
There is no black and white. There is gray. And we are always going through the gray zone. So to your question, the quick answer would be yes, it is possible. And we are doing it now. So the quick answer is yes. Now, the more elaborate answer would be at what extent? And it depends on the problem. For instance, is it QT prolongation in the ECG? So for this particular case, yes, there is a way of personalizing and produce a virtual human that reproduce a person or a population of virtual human. So it is like going step by step. And for some things are that we are more advanced than others. All this said, today this personalized virtual human to focus on one patient for a given problem, a very specific problem, with this level of detail I described before, or to use a similar model in a virtual population is an absolute reality. It's not science fiction. It's something that it is happening now.
What do you need in terms of computing power to run such simulation?
Our production runs, like the ones I described before, require kind of 1,000 cores. Today, 1,000 cores, there are instances in commercial clouds. So it is not your laptop, but it's going to be your laptop in, say, 5 years. Which means that if you work using high performance computing techniques, then in the very near future, these kind of runs are going to be a commodity. So you can run these things in a smaller computer. So this means that in 5 years, this is not going to be a supercomputer run. It's going to be a laptop run. And depending on the problem, progressively, we are going to advance, making it more multi-scale or more multi-physics. And then this will increase the complexity. Of course, there are going to be other problems that can be solved in a telephone. There are other cases in which you will need larger machines, especially if you want to solve a complex problem for a population, because in this case, you would like to run 1,000 individuals. Then each of the runs, you have to make more efficient each of the runs in order to run all of them.
For how long the supercomputer is working to simulate one heartbeat or, I don't know, 1,000 heartbeat?
If you want to run the simulation for a full heartbeat, it is something that it is about 1 hour or something like that. We have the expectations of reducing more this time. But at this moment, if you take the snapshots today, it's about 1 hour, more or less, one heartbeat.
Could you also briefly describe Mare Nostrum, what it is, how powerful it is, where it is located, and for what it is used for?
At the beginning, in 2005, it was Mare Nostrum, which was Mare Nostrum 1. Now we are using Mare Nostrum 5. So every 4 years or something, they upgrade the computer. The last one was a massive upgrade. Mare Nostrum 5 is about 15 times more powerful than it was Mare Nostrum 4, without 15 times more energy consumption. So the computer is more efficient. It is a pre-exascale machine, which means that it is a computer whose power is of about 30% of an exaflop. Exaflops are the power of doing computations in 1 second. Exaflop is a one followed by many, many zeros. Mare Nostrum has more than 1.5 million cores. So remember that we use 1,000 for each production run. So Mare Nostrum has a bit more than 1.5 million cores, which represents that to develop a code for these computers is not an easy task. It's something that you have to be trained and you need plenty of experience in order to take the most of the computer. Until Mare Nostrum 4, the computer was placed in a chapel. Mare Nostrum 5 did not fit in the chapel, so now we use the chapel for other things, and Mare Nostrum 5 is at the basement of the large building of BSc. The chapel is now used for some experimental computers like quantum computer.
Can quantum computing be a thing for in silico medicine, or at the moment is not foreseen its application?
This is a very interesting point, and it is also one advantage that we have because of being born at the Barcelona Supercomputing Center. We can have early access to new architectures, so new GPUs, new CPUs, new FPGAs, and quantum computers. So today, at this moment, the kind of applications that we are doing has no chance with quantum computers. So it cannot do anything related to what we do. But let's see in the future. We have done some tests on porting our code, some tiny parts of our code, which can be representative to emulators of a quantum computer. We have done this and we have measured the performance, and today is not that impressive at all. So we have to wait and see.
Why computer modeling and simulation can be a game changer for healthcare?
Because it is pervasive, so we can use in every domain of biomedical studies, and it can really accelerate to help understand the human body, accelerate a lot old therapies and new therapies, much better stratification of patients, reduce the bias in in silico clinical trials, because you can have, let us suppose that you have a computational models of female, male, children, obese people, fit people, different races, different sizes. So you can perform in silico clinical trials for all kinds of persons. There is a very nice book by Benjamin Labatut, which is a Chilean writer, in which it speaks about John von Neumann, but he says that he was looking for the mathematical roots of reality. So in what we do, we are doing the same thing, because a computational model is, before that, a mathematical model. So what we are doing is trying to use computational models in field in which nature plays many tricks, because it is very complex. But this is something that already happened. Today, almost, 80% of an aircraft is designed only through computers. So it is something that already happens in other industries and areas of science, like climate change, weather prediction, aerospace, oil, atomic energy, automotive. Why not biomedical?
And from the current perspective, what is the next big step that you expect in your field and that we can achieve in the, let's say, near future?
This is very interesting because, you know, sometimes if you think, for instance, the Manhattan Project, so the atomic bomb, many people have seen the movie, so many people know more or less the story. So they have an idea of doing something and they didn't know how. So in 5, 6 years, they build the technology from scratch. There were no technology for doing that. In this case, it's the opposite. The technology is there. You need to join the pieces, but technology is there. We have to perform a lot of validation studies, but the technology is there. So the fact that we are not using virtual humans on regular basis when we go to the doctor is or was mostly a cultural reason. It's not a technical reason. We could have been using these tools since, I don't know, 10 or 5 years ago, of course, evolving, right? So I think that the next revolution is more cultural than technical. It will come at the point at which all the stakeholders that can embrace this technology, like companies of medical devices, pharmaceutical, regulatory bodies like the EMA, healthcare systems, healthcare institutions. And I'm not saying patients, and I'm not saying researchers, and I'm not saying doctors, because I think that the three of them are already on board. It is more an institutional move. So the moment that this institutional move really happens, but now in a massive way, because islands are everywhere, but at the moment that this becomes a global move, that will be the revolution.
Awesome. Thank you very much to Mariano Vazquez for bringing us your insight. We hope to hear you again soon.
Thanks a lot, Davide. Thanks a lot.
And I also thank our listeners for being with us this year. This is the last episode of 2024, but we will be back next year. And I can already tell you that we have prepared an exciting schedule. So keep following us. I wish all of you nice holidays and a great 2025. Enjoy.
Da, 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 da.